Take you back to our top story. I was telling you that the KwaZulu-Natal government is worried about the spread of COVID-19, in particular in the eThekwini metro. It's recording the highest number of daily confirmed cases. It also makes up about half of the overall infections in the province. Premier Sihle Zikalala says that the KZN government is also seeing a decline in the recovery rate. He's been giving a briefing today on the situation. He gave that briefing earlier today and joins us now live via Zoom, I believe, to take this conversation further. Premier, a very good evening to you. Thank you for your time. So you are particularly worried about the eThekwini metro, which is where Durban is. It accounts now for about 50% of the overall infections in KZN, also recording the highest daily tally of COVID-19 cases. How are you going to bring those numbers down?
Well, thanks for having us in your program. We are going to try our best to ensure that we bring down the rate of infection in the whole province, especially in eThekwini district, which account for more than 50%. We have packaged a strategy which talks to public education so that we go back to embracing the new normal, which is wearing of masks, social distancing, sanitizing and washing of hands with soap. But on top of that, we will be strict in the public gatherings and public transport that people are preserving these regulations and protocols. Thirdly, we will then have, again, a program of tracing and testing. Tracing and screening and testing, where we will be screening people generally. But once we have established that these are people who are infected, we will then go to ensure that we trace contacts so that we will be able also to test the contact, quarantine them, and ensure that the spread is minimized.
I just want to pick up on the point you were making about the public awareness campaign about the importance of physical distancing, the wearing of masks. We're seeing a lot of people currently going around in their neighborhoods without those protocols, right? Is it an issue of people not knowing the importance thereof, or are they simply ignoring it because they don't think they'll catch COVID-19?
Well, I don't think there is someone who is not mindful of the fact that there is COVID-19, but I think some people are relaxing and taking things for granted. And we do need to conscientize them, create this awareness and appeal so that they understand the escalation of infection is worrying, but also the number of deaths. As infection is increasing, deaths are also increasing. And of last week, week 55, we lost about 111 people due to this pandemic.
And just on people then and their responsibility, yes, you're going to go on a public awareness campaign, but we've heard from yourselves, from the health minister and various other officials who've been saying to people, look, ultimately, even if we do get a vaccine, it is in our individual responsibility to make sure that we bring down the numbers of COVID-19 and that we make sure that we are safe. You see a situation where, anecdotally, people tell you that when clubs and restaurants close in line with the curfew, people drive to homes and they gather there, which also then exposes them to risk of contracting the virus. Are you seeing that as well in KZN?
Yes, we are seeing that where people will be gathering, even where when we say no, there will be no opening of restaurants and clubs. They will then organize themselves. That becomes a problem because such gatherings are also becoming super spreaders of the infection. We've seen that happening in various areas. We know and understand that people have to enjoy themselves. It is a festive season, but we are equally calling on our people to be responsible.
Should alcohol be taken away?
Well, we are comfortable with the current measures that have been put in place, whereby alcohol is sold until Thursday and thereafter there is a closure. We believe that approach is fine and working. What we now need to do is to deepen our engagement with communities. And that's why we are calling on all sectors to ensure that we participate public education, so that all of us will have this conscious understanding about the effect of this disease.
Final question then, Premier. You've got about 3,300, I think, beds in public health that are set aside to deal with COVID-19 patients who may need hospital admission at some point. Only 147 of those, I understand, are ICU beds. Do you think that will be enough to see you through the worst, especially with predictions that we're likely to see the situation become worse heading into early and late January?
We believe that will be sufficient, because we continue to make plans as we assess on a daily basis. But if there is a need, we could also be able to source other beds, ICU beds for that purpose. But for now, and the spread throughout the province, of course, the majority of them are in Durban and Pietermaritzburg, but there is a first spread in the whole province. And we believe the bed capacity is still fine, and it's allowing us to mitigate the effect of this virus.
I said that was the final question, but I do have a final one now. You've got over 400, I think, health workers who've already tested positive for the coronavirus. I know KZN in the initial stages of the lockdown was among the provinces where health workers were not happy with a supply of personal protective equipment and the like. As things stand, are you able to tell at all if the health workers who are becoming infected are contracting the virus on duty or outside of work?
Well, we will say both. Some comes with it from outside work, but some it's possible that because of the manner in which they will use PPEs, they will end up contracting a virus. But what I can safely confirm is that the PPEs are available in all healthcare facilities.
All right, Premier of the KwaZulu-Natal province, Sihle Zikalala, good to speak to you tonight, sir. You're watching South Africa Tonight.